Hey folks, Dr. Jeff Williams here. I am the owner, operator of Creekstone Integrated Care here, and I just wanted to give you an idea of one of the coolest, most effective things that we have for low back pain here in our clinic. It's called spinal decompression. This is the table. Here's the computer that runs the whole thing, and I'm sure you're probably saying, what the heck is spinal decompression? Let me tell you. So anytime somebody has bulging or herniated discs, this is number one. This is number one. It's amazing, absolutely amazing. It's also effective for spinal stenosis, for facet syndrome. The vertebrae stacking on top of each other, they fit together kind of like a puzzle. And if any of that's not working right, sometimes that decompression can really help pull and help things function just a little bit better. Almost all of the updated guidelines these days, from the American College of Physicians to a big medical journal over in the UK called the Lancet, been around since 1823. Even articles in the Journal of the American Medical Association within the last couple of years, they're showing the effectiveness of spinal manipulation for low back pain. Both recent low back pain and long-term has been going on for years. So spinal manipulation, we know that 90% of spinal manipulation in America is done by chiropractors. So that basically they're saying, go to the chiropractor with your low back pain. Now what happens when you get here, right? What happens when you get here at Creekstone, we will do an intake, we'll do a history. We're going to do an orthopedic and we're going to do a neurologic exam to try to figure out what all's going on, put all those puzzle pieces together and try to figure it out. Now, if it's simple stuff, then what we're probably going to do is we're going to stick with current guidelines around the world for low back pain and spinal pain in general. What we're going to do is we're going to mobilize things. That's what chiropractors do. That's what we're known for. We're going to potentially use massage. That's a first-line treatment. For chronic long-term acupuncture, they're even the medical field's even recommending acupuncture. Isn't that amazing? We're going to do some exercise rehab. We're going to send you exercises home that you can do that can really help you manage this, dude. Now, if it's more serious than that, if it's a disc, if it's stenosis, degenerated discs, or just simple bulging or herniated disc, what we're going to do is we're going to recommend decompression because it is an absolute game changer. And medical research by Edward Ironman, MD, showed that in their test subjects for decompression, they were able to fatten the disc up, maybe not to brand new, but they were able to rehydrate it, and they were able to reduce the disc bulges, and they were able to help fix or heal the crack in the disc that allowed the bulge in the first place. So I'm just telling you, it is highly, highly effective, and we've seen it help our patients avoid surgery. You know, I told you the first line stuff here is simple, safe, conservative, non-pharma. The more serious stuff like opioids, like injections, and surgery, those are the last things you should do. After everything else, all the easier conservative stuff has failed, then you look at injections, and then you look at surgery as an exiting point. But from the get-go, when you come in, if it's a disc, we're gonna introduce you to decompression. And really, the worst side effect on decompression is you may fall asleep and start snoring, okay? And we'll wake you up, not a big deal. Nobody's gonna laugh at you very much. So if you're having back problems, get in here. Let us start working with you. Let us figure out what the heck's going on, and let's really avoid all that other invasive, serious stuff, because low back pain, spinal pain, neck pain, those things can usually be handled easily and conservatively with a little bit of buy-in and a little bit of consistency on the patient's part. So if that's you, give us a holler, 806-355-3000, and we'll get to work. Be sure to find me on social media sites such as Facebook, Twitter, Google+, Pinterest, LinkedIn, Snapchat, Instagram, and YouTube. While you're at it, give us a thumbs up on YouTube. That's super simple. Be sure and visit chiropractic4.com. Give our podcast a listen. Lots of wonderful, wonderful information there. And as always, thanks for listening. We'll see you next time.